Prof. A very good afternoon to you. Thank you so much for your time. The debate over the past 2 weeks or so has been about whether or not to institute a hard lockdown, and you're of the view that that sort of lockdown has served its purpose.
So, good afternoon and thank you very much. I don't think going to a higher lockdown is going to achieve much. You know, lockdowns do bring very great socio-economic hardships. I think now it's about managing the epidemic and mitigating the effect on particularly the vulnerable population who will develop or who are at most at risk for severe disease.
So we're speaking about the economic risk, and that's what government has put forth as far as to why we've even had to move to level 3. But in places like China, where COVID-19 started, we've seen areas where there's been a resurgence in cases being shut down, even if it's for a few days or a few weeks, to respond to that. Would you say that's the best course for South Africa to say, for example, shut down Johannesburg for a period until it's stabilized?
I don't think that's the way to go. I think, you know, the economic, as I mentioned, the economic hardships are huge. Psychological hardships are massive, and socio-economic effects really need to be considered in any intervention. From a health point of view, I think it's critical that those who are at risk for complicated COVID, severe COVID that might result in unfavorable outcomes, need to do personal lockdowns. And I think as the lockdowns have been released, people think everything is okay, but we're in the surge phase. And people, I think, have the wrong impression that things are okay. You know, the enemy seems to be invisible to most. But we each need to take responsibility for protecting ourselves, and particularly those who are vulnerable.
Just on that responsibility then, how do you convince people to get back on board and do their part? Because I can tell you of cases I've seen on social media where on a Saturday night people are posting pictures and video from braais and all sorts of other gatherings.
I know that, and that's very worrying. Yeah, we need to get the message out there about the severity of illness, the risk group who are very concerning, and I think Professor Kirtan mentioned some of them in his insert. Yes, it's about getting the messages out there in a way that people understand that actually we're in the worst part of the COVID outbreak. Horrible pictures of Italy, dreadful scenes in hospitals, I really think brought to the nation what COVID is about, and we're not actually seeing that. When you walk in the street, you don't see COVID. You know, it's an invisible enemy. But people who are, you know, older than 50, particularly older than 60, those who are obese, those who are diabetic with hypertension, and a number of other chronic medical conditions absolutely need to take care to protect themselves from infection. Those are the majority of patients who are being admitted to hospital and are experiencing severe disease. And we absolutely have to take responsibility for that.
Just on the point that you make about hospital admissions, Prof, we had another medical expert on the channel yesterday who was saying we can have all the beds in the world, but if we don't have enough oxygen, ICU beds, and the other critical care tools that are needed at this point, it's pointless to have all of that. What is your understanding of where we are as far as ICU beds and critical care products or equipment is concerned?
So hospitals are really at capacity. The doctors, nurses and healthcare workers on the front line are doing an extraordinary job, and we need to recognize what they have done. Oxygen is a critical component of treatment. So many people think about ventilators as the clinical intervention, but it's oxygen and some new non-ventilator type interventions that have become very important in managing this outbreak. And that is the direction that we need to go in. Oxygen, beds, high flow oxygen, not the ventilator route. Good nursing are absolutely critical. And early presentation, if you have a risk factor and you start to develop shortness of breath, early management with oxygen. Oxygen is life-saving for many cases. Some patients may need more.
And the reality is we don't have enough of that. All the ICU beds, as things stand, we're told more is being ordered. You mentioned Italy earlier in our conversation about people's attitudes. How far are we from an Italy scenario where people are lining hallways at hospitals, queuing for these essentials, but sadly cannot be helped because there simply isn't enough to go around?
So we can expect more cases. We're far from the peak. We can expect more admissions into hospitals in the next day to weeks. I think the Western Cape had their surge first. I don't think they've reached their peak. Increase in cases in the last week or 2 weeks in Gauteng been dramatic. Eastern Cape has been very similar. Their resources are very much less. I think we can expect more cases in KZN. I think provinces with less metropolitan areas perhaps will follow but have lower peaks. Difficult to know, but it's an extremely busy time. So people absolutely need to recognize, despite the lockdowns being released, we're in a very dangerous phase of COVID.
Final question, Prof. At the beginning of our outbreak, there was a significant amount of optimism that was gained from our high recovery rate. It was well over 50%. On the 27th of June, in fact, it was at 50.9%. Just last night, from those figures, we were sitting at about 47.6%. How closely are you watching that?
So it's difficult to have an accurate figure about those who are infected. You know, we are needing to focus our testing on patients who in hospital, healthcare workers with symptoms, because it affects management. So it's difficult to know how many people are infected in the community, because we shouldn't be doing widespread community testing, because we need to save our tests for the priority groups. So, I don't think one should put too much store by those, a slight decrease in figures. I think we're still seeing more than 50% recovering. We will see more. Some of those who are in hospital will recover. I think we have the benefit of following outbreaks in the Northern Hemisphere, where many different treatment interventions have been tried. So we have the benefits of knowing what does work and what works best. So, there is some optimism there, but I think it's still about being cautious, taking your responsibility for your own lockdowns, I think reducing your risks in high-risk groups, which are really the concerning groups.
Professor Lucille Bloomberg from the National Institute for Communicable Diseases, thank you so much for your time this afternoon.